very large Medicaid population, and we have a very large with no insurance coverage whatsoever. And we don't have a lot of blue-collar work opportunities. So as a result, you have a lot of people that are self-employed, therefore uninsured, or self-insured, if you want to think of it that way.
There are some rural areas with a high proportion of patients who have diabetes, and so this is just about an hour away from Lexington, and pretty high incidence of diabetes in this area. The state of Kentucky in general has a high incidence. It's very frustrating, I think, as a pharmacist, and we see this all across the country. I mean, it happens in Lexington just like it happens in our rural communities, where we will have providers who will refer patients to the program, and there are access issues from the financial barrier. So does this person have the right insurance, or do we have an agreement with their employer, or do we have things in place?
Unfortunately, there are other brittle diabetics out here that conversations aren't going to do a whole lot.
Sure.
But if they understand the disease state, I think they will look at dietary changes or exercise and things that they can do.
That's the main problem there. It's like they're terrified. We've actually kept statistics on the number of people when they're first referred who actually keep their appointment, and it's about 50% that ever keep their first appointment, and they just, you never know.
One of the things that I think has been most successful with our program in Lexington is that our patients will say the accountability of knowing I'm coming to see you every 3 to 6 months helps keep me on track. So knowing that there is somebody who's going to ask me questions, keep me accountable, review my medications, am I taking my medications, am I following up on my behavioral goals, that is the component that I think has really helped.
Another patient I have discussed with you about was a patient I talked about the diabetes program about. This patient weighs well over 300 pounds, and for her, she did not know anything about her diabetes. She got less than half the questions right, but she has taken it upon herself to change her diet from drinking 6 Mountain Dews from a time from 3 o'clock in the afternoon till 11 o'clock at night to drinking straight water. And this time she's lost 20 pounds in a matter of 6 to 8 weeks.
So how can we increase the access, eliminate the financial barriers and the walls of you have this insurance or that insurance or no insurance at all, and how do we put them into place and connect them with those groups? I
have a real problem when patients say, if I don't get my sugar under control, I'm going to have to use a needle. We've got to change the perception that the needle is the terrible thing.
Again, one of the most exciting things about the project is that we look at this as sort of planting a seed in the area, creating that network of pharmacists who are available and ready to go.